And welcome to Duke Spine Institute, where we're streaming live spine surgery. Our patient comes from Canada, from Ontario, and he has a bad disc herniation at L4-5 on the left side. It's causing horrific back pain as well as pain down his leg. He also has a piriformis syndrome on the left side. He has a piriformis syndrome on the left side as well. We're going to treat the disc and then we're going to treat the piriformis. All right, so let's get started. We'll do some num-num. We're going to give you some numbing medicine. Lay still, don't move, just a little stick and burn. Sorry about that. Our patient will be awake just for the first few minutes while we get started. Num-num. All right, if you have questions, feel free to ask me. The first part of the surgery is getting into the disc herniation. We got to go from the operating room down to the herniation. To do that, we use a needle like the one you're seeing right now. Shot. All right, not bad. I'm putting in some numbing medicine in the skin and muscles so that it's more comfortable for the patient. That will reduce his cardiovascular response. Okay, shot. Looking good. Might reposition a slight bit north. Any questions, feel free to ask me. He's here with his lovely wife. I've met her, and they are from Canada, specifically Ontario. I want to start just a little bit more lateral now that I'm... By the way, every patient's slightly different, okay? And what varies is there's so many things that vary. The pedicle distance varies, the intervertebral distance varies, the height of the disc varies, the size of the facets vary, the facet capsule varies, but in the end, the problem with the disc is always the same. I can feel the herniation. It's right there. See the tip of the needle? Jordan, show us the tip. Henry, you see the tip?
Yes, we do.
Right there. Okay, the herniation is all the way there. It's a big mushroom. All right, let's go AP, verify, and then we're going to put the needle in. We're going to do a discogram, and we're going to do his surgery. If you have questions, type them up for me. You're watching live spine surgery on December 19, 2024. There we go. Perfect. So we're ready. All right. Is he awake?
How are you doing, my friend? You okay?
How long has he had back pain for?
You said 4 to 6 months.
All right. So lower back pain is what we're treating, as well as pain from his back going down his leg. Now he's also got a torn muscle here called the piriformis muscle tear. We're going to fix this as well by doing a small incision and releasing the muscle. Yes, no, maybe so.
How are you doing? You okay?
You all right? All right.
Still sleepy?
Shot. There we go. All right, big tear in the back. Shot. Yep. All right, let's just go ahead and proceed. You can see the tear in the back of the disc. I want you to look at the dye on the lateral view. You see that big black collection of dye? That's normal. You should always see that cotton ball, we call it. But the part that's coming out to the periphery is all abnormal, should not be there. And it's leaking out through a tear. That's called the annular tear, and that's what we're going to fix today with the laser. He's traveled here with his wife from Canada because they don't offer surgery like this in Canada. As a matter of fact, they don't offer this kind of surgery anywhere in the United States or the rest of the world except here at Duke Spine. Any questions?
Yes, we have a question coming from Faisal on Facebook.
Knife.
Saying, hi doctor, hope you're well.
Faisal?
If you have a muscle tear in the back and it's not healing because of causing back pain, how would you treat a muscle tear that's not healing and maybe irritating nerves and causing inflammation? Thank you.
Hey Faisal, first of all, muscles never cause pain that needs to be treated except for the piriformis muscle. That's the only one, okay? Other muscles in your back never need to be treated for pain. The problem is not the muscle, the problem is the joints. It's your joints that need to be treated, not the muscles. The only muscle in your lower back that causes back pain is your piriformis muscle, and that's going to be released during this surgery. Muscle pain along the spine is secondary to pain coming from an injured joint. You understand? The pain is the sound that the injured joint makes. It's a signal that's sent to the brain that there's an injury in that joint. It's making the brain aware that there's an injury. Muscles almost never get injured, and when they do, they cause pain as well, but they heal very quickly, usually within a day or two. The muscles you're talking about are hurting only because the joint hurts. So the muscles around the joint spasm and cause pain. And your brain perceives that pain as pain from the muscle. However, it's not pain that needs to be treated. You just have to fix the joint problem, the disc or the facet or the SI or the piriformis, and the rest of it goes away. Okay, we are in the L4-5 disc. Everybody agree, left 4-5? Yes? And then we're going to fix this with the laser. You can tell, based on his x-ray, the disc height is really good. It's well preserved, meaning that this injury is not an old injury. It's a new injury, and I think he's going to do really well. Which laser fiber?
Oh, this is Boston.
Huh?
Boston.
Oh, I thought we were going to try the...
We in the next case, we next case. Or if you wanna, we can show you the switch.
I want the non-Boston. Any questions, Henry?
At this moment, no current questions.
Let's show our audience then, why does back pain, what causes back pain in patients? There are 30 different causes, and the most common is the disc, like this patient coming from Canada. But let's show them all the causes.
Copy that.
I'm Dr. R. Duke Majan with the Duke Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Duke laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5-S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L1-2, L2-3, L3-4, L4-5, and L5-S1. The most common facet joints to cause chronic back pain are L4-5, followed by L5-S1, followed by L3-4, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Duke plasma rhizotomy of the SI joints offered at Duke Spine or Duke Joint Institute. The fourth most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Duke piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic pain down their legs, with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, such as the vertebral bodies, with trauma can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Duke Majan. Thanks for joining us. Welcome back. You can see from our animation that on our video that there are 30 specific distinct causes of back pain, and Duke Spine Institute has identified all of them. Now, it turns out 99% of the time, the back pain is coming from the disc, facet, SI joint, piriformis muscle. And because of that, we have a cure for each of those. Because we have a cure for those 4 top causes, that means we can cure 99% of back pain. That's chronic. We don't cure cancer pain. We don't cure infections at Duke Spine, typically. We do some infections, but not many. But the point I'm trying to make is, number one, if you've got chronic back pain, it's likely that it's curable. Very likely. Number two, Duke Spine can cure it if you come here. And before you even come here, first do our MRI review so we can figure out exactly what's wrong. Like this patient, he did his MRI review from Canada, and we told him what was wrong. He came here, and now we're fixing it. He's going to do really well. All right, you have a question from Faisal.
Yes, question from Faisal asking, thank you, doctor. Have you ever treated T4 syndrome, and what symptoms would a patient complain about?
All right, so first of all, I've never heard of T4 syndrome, Faisal, but I don't know if you're referring to a disc pain at T4, maybe T4, T5, or T4, 3, 4. But yes, I've treated herniated discs at T4, 5. That is the most common cause of pain in that area. The other cause would be the facet joints or even a fracture. I assume you're not referring to a fracture though. All right, now this is interesting. I want to show you guys something really, really cool. You guys see that vein right there? That big fat vein right there?
Yes, we do.
All right. That vein is big, isn't it? We don't see veins that big normally. Okay? I could hit it with a laser and it will literally burst it open and it'll start bleeding. We're not going to do that. Point is, that vein, look how big it is. Do you know why this vein is so big? The answer is because the disc herniation has only been for a short time. You see, chronic large disc herniation, they cause so much inflammation around the disc that the veins will scar down and become small. You won't see them. So most of our patients, we never see the veins. Okay? We see it on this one because this herniation is new. It's not old. It's new. So the amount of scarring of the vein has not happened. Okay? That's why we see it. that's a normal looking vein. It's called Batson's plexus. All right. All right, let me show you guys. We're done. The nerve root is going to be right up there in that fat. But there's his tear. It's already less than 5 millimeters. It's about 4 millimeters wide. So we already helped it, and we're done. No more questions. We're going to end the stream. We're going to come back for a piriformis release.